Hello, everybody. My name is Ernest Covington III, and I'm the Executive Director of the Commission on the Deaf and Hard of Hearing. We're very, very excited today to have a conversation by meeting with two of our representatives in the community who are going to focus on mental health, particularly during COVID. They're going to talk about the deaf and hard of hearing experience from their different points of view. We have one person who uses ASL, and we have another person who can sign, but in this particular instance, will be speaking, and we'll be talking about the hard of hearing perspective and the hearing loss perspective. In honor of Hearing Loss Awareness Month, we want to listen to both sides and hear the various experiences in each language. So I'm very happy to have the two of you. Maybe you could introduce yourselves to our audience and tell us a little bit about yourselves. We'd really like to get to know you.
Dru, if it's okay, I'm going to start off.
Sure thing.
Okay, great. My name is Caroline Obrecht. I'm a clinical social worker, and I am in private practice here in Providence. My background is that I was born fully hearing. My major in college was romance languages, French and Spanish. And when I graduated college, I had absolutely no clue what I was going to do with the rest of my life. I grew up in a family where my maternal grandmother was deaf from about the age of 3, and my dad was hard of hearing and later in life legally blind. I was always interested in how people connect and languages, and so that led to a natural progression for me of taking my first American Sign Language class with BJ Wood. Thank you, BJ. My family was also very interested in civil rights. So all of that was in my head as I started studying sign language, got a master's degree in deafness rehabilitation from New York University, and then went on to work for the Massachusetts Rehabilitation Commission as a rehab counselor with deaf and hard of hearing people. At that time, MRC had money, and was an exciting place to work. And not only could we do things for our clients, but they also sent me to study at Northeastern. I spent a couple weeks, 2 summers at Gallaudet, really helped my sign language. I became state screened to interpret. I have to say, honestly, I never felt that I was that good at it. So I decided I would go on and get my degree in social work, which I did. And probably about 20 years ago, I suddenly developed something called Meniere's disease, which is an inner ear disorder, fluid imbalance, which causes precipitous hearing loss, in my case, in one ear, balance problems, and constant noise in the ear. People call it ringing. It's not really ringing, but it distorts the sound in the ear, so I could no longer hear from that ear. I had a period of adjustment, really kind of changed my image of myself. And of course, all social workers, therapists, I believe, bring their life experiences to their work. So while I've been working with deaf and hard of hearing people, now I felt that I was, part of the hard of hearing community, although I could pass in a quiet environment because I speak like a hearing person. And I did use a hearing aid for a while, but I didn't love it. And I'm also pretty cranky about how expensive they are. So I've been doing without. So I'm going to talk today more about my work with hard of hearing people. I see everybody. I see hearing, culturally deaf, lowercase deaf, hard of hearing. People come to me for reasons that have nothing to do with their hearing status. But when I do work with somebody who's hard of hearing, I try to make sure that I know why they come to see me. They may be coming for reasons that have nothing to do with how well they hear or don't hear. It may be a matter of depression or something that's going on in their life, or any of a number of things. So it's my job to kind of match the patient where they are and see how we can best work together. Sometimes that means that they very much want to focus on hearing issues. And in that case, I can be a resource for them, but not always. So that's me, and we'll have an opportunity to talk more.
Wow, that was so interesting. It's good to get to know you more, Carolyn. My name is Dru Balsley. I grew up in Massachusetts. I was mainstreamed. I was born deaf. Hearing aids never worked for me. We had home signs mixed with C signs at home. And then when I went to school, there was some ASL exposure. So I have a combination of language exposures. I work with all different kinds of people. As I was growing up, I attended 9 different schools. So I met a variety of people. Some were oral, some were mainstream, some were complete ASL users. And then I went off to Gallaudet and I majored in psychology, which I was fascinated with. I'm interested in behaviors. I'm interested in my peers and the wide variety in my peers. I'm just curious about people in general. And I began to realize that where I am in my family, as far as I am the first deaf person my family has ever met. My parents found out I was deaf when I was 3 months old. And they had a very strong belief that I should have a great quality of life, that I could be successful, that I could do anything. And I realized my parents really believed in me, which is absolutely what helped me become who I am today. A lot of my friends have different experiences. They had very different exposure to deafness. They had a sense of maybe, it's fine to be deaf, but others had a sense of not being told they can't do certain things, that they were somehow trapped, in limitations. And I always say to them, it's not true. I mean, we can do anything. If you have a passion about something, that's what you should be doing. And I always wanted to work in the area of therapy. So I went to, Bridgewater State University in Massachusetts. And I was very interested in clinical psychology. I did some outpatient therapy with adults, mostly deaf and hard of hearing adults, and started thinking I wanted to, thinking about my parents and always telling me I could do what I wanted and follow my passion. I ended up at Walden School, which is at the Learning Center in Framingham, Massachusetts. And I work with young children and with a strong focus on emotional experiences. Many of them have experienced trauma or other challenges in their lives. And it's just amazing to have an opportunity to work with them and help them figure out who they are and work in that whole mental health sphere on who they are and understand what their issues are. Sometimes they're diagnosed with certain behaviors, but that's not necessarily who they are. It may just be a symptom. And so I love to focus on the whole person. That's who I am, and that's what I do. And that's a little bit about me. Thank you. That's fascinating listening to both of you. I'd like to ask you both, what would you say inspired you to work in the mental health field in the first place? What made you decide that's where you belonged? This is Dru. I already mentioned that what I observed throughout my life. I did have an internship in college, and it had an impact on me. There was a lot of talk about opportunities for access and having a support system. And I had to really think about that. In the mental health arena, it really impacts people. What if they don't have access to the help that's needed? And I wanted to be a person who could make a difference. And at that point, I had an opportunity to get kind of involved in that journey. I've seen people grow from youth to adults because of having access. And sometimes they come back to visit me. And I'm just so amazed to see how people have progressed in their lives and have finally become themselves. And that really inspires me. Wow, Dru, that's amazing. Carolyn?
I had some of the same experience. I've always been troubled by the stigma about mental health issues and how they're viewed very differently than physical health. So that was something that influenced me. And then through working at different places, maybe most notably Butler Hospital, I also saw some amazing turnarounds. I remember there was a young man who had obsessive compulsive disorder, so severe, he couldn't get through a doorway. He would rock back and forth for hours at a time. And after he got the appropriate treatment, a couple of years later, I heard that he had gone to medical school and that he had driven back to Rhode Island to visit people. And I was actually happy to hear he'd gotten a speeding ticket. It's the only time I've ever been happy to hear about a speeding ticket. So good things do happen.
That's great. Wow, I like that story. That's amazing. Um, as a deaf therapist, as a hard of hearing therapist, what would you say your perspective or your philosophy of your practice is for both hard of hearing and deaf? Do you have a philosophy of practice? And can you tell us about that?
So
Typical versus philosophical.
yeah, so of course, first and foremost is respect. And so I'm going to talk about working with hard of hearing people. So something I think about is balance, not to jump in and start talking about my story, like that's relevant to everyone. No, it's more important to hear their story and see where they are in terms of acceptance or denial or grief even, because losing your hearing can be a real loss, and working with them from that point on. So, and then just practically making my environment comfortable so that people can see clearly. There's not a lot of visual noise in my office. And I try to be careful about background noise within the office itself.
Yeah, just thinking about that question, Carolyn, you really talked, what's so important is respect of who the person is. Sometimes, depending on kids, like teenagers, if I'm working with a younger person, there may be a family that doesn't understand deafness or hearing loss, or a family that has very different expectations that my patient then internalizes. So I focus on what they need. I sometimes share my experience just to normalize their experience. So they know that, oh, that's not just me. So, and Caroline, as you said, balance is so important. Also, with teenagers or children, what I see a lot, because I do work in a therapeutic program, so it's a little bit of a different environment. We often have people who've experienced language deprivation. And that means that my office might use a lot of visual aids, things that provide access, like drawing or access for actually acting out things. And one of my approaches is meditation and mindfulness. So, especially in terms of trauma, sometimes that affects the body. Trauma can be actually have physical manifestations, and a lot of times children have things. And I don't know if you know this about me, but I am a trained yoga instructor. And so I do oftentimes use yoga in my therapy. We have mats ready, or you can sit in a chair and do yoga. And we have other things that can be moved around the office. Sometimes we have a ball that we throw back and forth just to develop rhythm to sort of calm the mind. So it's a real mixture of sitting and talking, but it's also a lot of action in my office. So it's a different environment altogether. Um, it might be a little overwhelming, Carolyn, in your office compared to what goes on in my office.
Well, maybe, but I also use mindfulness skills because I know that when people are feeling overwhelmed, their ability to take in information and function is compromised. So a lot of mindfulness skills that I've been taught, first thing they tell you is close your eyes. Well, I don't do that. So I've worked out other ways to work with people so that they can work on the breath, they can work on relaxing their body, but they can also get the information that they need.
Yeah, definitely. Okay, another question I had. I know that COVID is here with us. We've been living through this pandemic. I wonder, what are some of your challenges with technology? How has that been going for you lately?
I think I'm the queen of technological challenges. Um, I resisted technology for many years. Um, about a year ago, Tim Riker taught me how to Zoom. I have to say, I was so embarrassed. I couldn't even tell Tim I didn't have a computer with a camera on it. I had to go out and buy a laptop and get the right kind of computer. I know. It's terrible. So I'm working very hard to catch up, and it makes me incredibly empathic towards my other clients who may be my age or older, who have never touched a computer. So yeah, that's been my challenge. Oh, although I have to say, I love going to the gym, and I have not been going to the gym with COVID, but I am doing yoga classes through Zoom, and I am so grateful for it.
Oh, wow. How great.
Mhm.
Yeah, I always encourage people to do yoga. Yeah, I agree, Caroline. Technology it runs the show. I have not, I mean, look at this. Ever since the virus hit, I had some students who actually live at our school. They live in our program and they stayed in our program. So we were able to still meet in person. The mask part, though, oh my goodness. You miss so much facial expression, so much information. So we really had to modify. But I found out that I don't show my expressions well at all from the nose up. And that was hard. People thought I was angry, and I wasn't. But Zoom, in some ways, solved that problem because if students were home for a break or something or a holiday, we would switch over to Zoom therapy. And they said, "Oh, you're not angry at me. There's your face." And that was good feedback for me. So, in some ways, it's been a godsend. And for some students, who've been home the whole time, we've done all of our therapy on Zoom. It's an adjustment. It's, what can I say? It's a big deal. I'm very appreciative of having the access through technology, but it's two-dimensional. In my office, I have all these tools, but on Zoom, I don't. I can't do as much with them. At the same time, I can look at the body language. I can't see the entire body, but if a person's really nervous, maybe they'll be tapping their foot. I won't see that. I wish I could. Another challenge with technology is that, like for therapy, um, people are sort of showing us what their homes look like. Maybe they'd rather not. They feel like it's their private area, it's their personal space, and now they're exposing themselves, by showing off their homes. In some cases, They don't even have access to a laptop or an iPad for financial reasons or any number of reasons. So that has been an issue. We try to make sure that all the kids have a device. So the Learning Center's been very good about that. But COVID has really spotlighted the challenges that we used to overlook. We never even really knew about. So on the one hand, I knew that my students had certain needs, but in some ways now those are really highlighted. And I can see the shame or the embarrassment on their faces and, grief too. With Zoom, people are so isolated. So a lot of deaf people are especially isolated. They may be home with their family. Many families don't know sign language. There may be some cases where the family does sign, and that's great, but in other cases, the family doesn't. So that really magnifies the isolation. And so Zoom, as much as it's not ideal, it's not a total balance, I'm looking forward actually to getting back in person.
Oh, I am too. I miss being in person, but I often think if we hadn't had Zoom, what would this be like? I can't imagine. But I do have one little complaint, which is when Zoom freezes. And why does it always freeze when I have the worst expression on my face? It's just awful. So if there's any way they could ever fix that, I would be very happy.
Yeah, it's Murphy's Law. It has to freeze when you're making a face that you'd rather
Yes,
not be making. It's
yes.
just, it's a law.
It's true.
Okay. Wow, this is so interesting. The pros and cons of technology. Hopefully, yes, the technology will improve. And also, of course, hopefully we'll be back in person. But technology in some ways has been a lifesaver. And it's so great that you're in a program, Dru, that gives out the technology to the students. We try to make sure that there are resources for people, and that's ideal. I do have another question. Do you have any tips or any helpful suggestions that may be good for parents or children to deal with challenges like isolation or depression? I'm just wondering, I don't know, are there some different strategies that you use to help people deal with these challenges, particularly during COVID? It's been over a year and it's not done. I mean, we don't really know when this is going to be completely over. So I'm wondering what kind of tips you have for either adults or children to help us get through. This is Dru. We can just go back and forth with our ideas. I have a couple of thoughts. You want to make sure everyone has a support system. Someone, whether it's through Zoom, whether it's someone at the house. Also, you need to give yourself permission to be nervous, to feel depressed, to feel bad about this situation. This is a very atypical situation, and isolation, it's not natural for humans. So it's okay to feel a little bit off balance and out of place. It's normal. So with the support system, it might be something like a regular Zoom or a regular FaceTime with a friend or a family member just for a casual conversation. I know technology is a pain, but sometimes the connection makes it worth it. Ironically, connection's important, and also technology can actually be a barrier because like too much TV disconnects you, too much time on your phone disconnects you. And I'm guilty of that. Oh my goodness, I go online and find myself spending a lot of time on the internet. The truth is, we should really be going outside, not staying inside. We really need to get out there and, you may feel it's a little bit risky, but try to find a quiet park, a place that's just not busy, where you can go for a walk. If you have an animal, take the animal with you. I don't know, Carolyn, do you have any other suggestions off the top of your head?
Yeah, Drew, I very much like everything you've said. Um, I would add for kids and adults to try to have structure in your life. In other words, a schedule, not to be rigid about it, but something that you follow. I also think if you can have a project that uses your hands, knitting, drawing, working with clay, any of that can be really soothing. And it's also nice at the end of the day to be able to look at something that you created, something tangible. So, and I think that can be good for parents and kids too. Particularly if the parents don't sign, that's something that doesn't really require a lot of formal communication.
Yes. Oh, I just thought of something to add to your comments, Caroline, about you were talking about structure, having structure in your day. Some people don't really know what structure is. It could be something as, eating at a certain time of day, having your meals at a certain time, like maybe every day you eat at 6 or 6:30. And you know that. So there's no, worry about that. It's on the schedule. And you don't have to worry about your schedule being just totally amorphous. Many of us have work schedules or school schedules or something else going on, something else to do, like a certain time of day that you go for a walk. Maybe make that at a routine time of day. So yeah, as much as it doesn't have to be rigid, not like 6 o'clock eat, 6:05 brush your teeth. I'm not talking about that at all, but general parameters. A routine that helps you know what's next and makes your day more predictable. With COVID, we can't predict anything, but we can predict our days, and I think that can be really beneficial.
And I would add one thing, Drew, you talked about, recognizing that your feelings are your feelings. I would add to that self-compassion, being kind to yourself, being as nice to yourself as you are to your friends, and not critical. So, instead of saying, well, I was home all this time, my house should be perfectly clean. No, I'm home and I'm doing my best. Just be kind.
Yes, yes, definitely. You talked about routines. I think that's so important to keep your daily schedule. And I was just reading something really interesting that a lot of people struggle with how to start their day, if they're working remotely, for example. And I'm really interested to know, some people actually said it helps them to go get in their car and go to work because that's their time away from everything, sort of in between their home and their work. And they use that time to kind of sort themselves out. And then when they get to work, they're fine. And then they turn around and go home and then they're ready to start their day. So sometimes a routine, even something like that, can be helpful. That's funny. That made me think of something with my husband and I. I still actually physically go to work in person. So I still have that time in my car. My husband works from home. So his routine now is he gets up early, just like I do. He sets up his computer, gets everything ready to go for the day. And then he might go and make breakfast. And then he sits down at the same time every day. And he's ready to work. Same time, same place. The office, his office at home is all set. So he doesn't touch it until it's time to work. But that was something he came up with on his own. And I think it's great.
And maybe less concrete than that or less clear than that. I like to start each day by thinking, today, I really, 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 3 times want. And then I think about something I want to accomplish that day. It doesn't have to be anything big, but it sort of sets my intention. And then at the end of the day, I like to think about something I'm grateful for. And it's silly things sometimes. I watch a lot of birds out of my window when I'm working. So just thinking about birds I've seen or kids walking by the house or whatever, just something that gave me a moment of feeling good.
Yeah. Oh, I agree with you. Since, as you know, it's been a year since the pandemic started, how do we deal with the anxiety or the fear that comes up when we think about actually returning to normal, back to our normal lives? I mean, it's strange, but do you have any thoughts on dealing with that?
I think it's going to take time. I think the news this morning about the Johnson and Johnson vaccine was too bad, a step back. But I
Right.
think that with more of us getting vaccinated and watching the infection rates go down, we'll feel a little calmer. And I would urge people not to jump in, but just slowly start to get together with friends and family, see what feels comfortable, and go from there. Go at your own pace.
Yes. And also be okay with the feelings that might come up. We were just talking, I mean, there's so many feelings that have come up during the pandemic. They're not just going to disappear. Now we can be nervous and anxious about returning to normal. People are afraid. What if I get sick? I mean, there's going to be some mistrust out there. And really, you said it, Caroline, go at your own pace. Don't feel like you have to jump right back in. Don't let yourself be forced into just jumping back into normal life. And be sure to communicate that with whomever you need to tell. If it's people in your home or people around you, just be clear and transparent that you may not be comfortable yet with, fully having large meetings or whatever it may be. And people should respect how you feel, but be sure to share that. A lot of people will understand because I think a lot of people are going through the same exact thing. For example, you may be okay with getting together, but only outside, not inside, which is perfectly fine. As long as you're clear about what you're comfortable with, that's really the important thing.
Mhm.
Um, that's a good one. Oh, I just thought of another one. This is Dru. Um, Caroline and I were talking earlier about access to information and the news, and people are watching it very closely. It can become overwhelming. Sometimes you need to take a step back and give yourself less exposure to the news, because that can impact your anxiety levels. So you want to balance what information you actually need to know versus what information is just going to make you more anxious. And finding that balance is key. I didn't want to leave that out.
Yeah, that's an extremely important point.
Wow. Yeah. Thank you for those. Those tips are really, really helpful. I think that's going to help the deaf and hard of hearing community a lot. We all need to understand the challenges working through COVID, and it's affected all of us. So knowing that we're all going through it is going to be helpful for everybody. Also, the idea of getting back to normal, doing it at your own pace, that makes so much sense. I really like that you said that. Thank you for that. We're going to be wrapping up now. Um, is there anything that either of you would like to share with the community that we haven't mentioned yet in this conversation? What would you like to say that you may not have had a chance to say yet?
So I think for me, um, I started off, I think, talking a little bit about the stigma of mental illness. And one of my colleagues has a little poster in her room that I really like. It says, depression is a chemical imbalance, not a personal failing. And I think that's a good one. I like that. And I hope people understand what they mean is, it's not that you did something wrong or you're not working hard enough. That is an illness, just like many other illnesses.
Huh, interesting. Oh, another one, I think people don't realize that mental health in general, I mean, it's very common mental health issues. In your lifetime, you will experience changes, adjustments, things that really throw you off balance. It happens to many people. And a lot of people struggle with mental health challenges, whether it's an experience or not. And a lot of times, those experiences or those challenges make us stronger. And it's not who you are, it should not be your personal identity. It's really important to see people for who they are. And with COVID and how people respond to it, maybe they're really feel fearful or very paranoid. That doesn't mean that's who that person is. That's merely a response to an unusual situation. And so there are different responses to these triggers like COVID. And some people take medication, some don't. Some people are more social, some are not. So there are so many reasons behind what makes a person behave the way they do. We can't judge them from that behavior, by that behavior. I have a lot of compassion. We have to have a lot of compassion for one another.
And that there are many different treatment possibilities. And you're right, Dru, not everybody needs medicine. So finding the one that's right for you.
Okay, I think this was an excellent discussion. I actually learned a lot today, and I want to thank you both so much for your time and your comments. I really look forward to talking with you more in the future. Thank you for your time once again. And this is Ernest. Yes, thank you both very, very much. This was excellent.
Thank you for inviting us.